we've been here for over 3 weeks now, and I have been applying to several jobs. And in the process of application or applying, some of them called me for interviews. So I tried to record some of these interviews because some of them were virtual. Like there was a robot that was asking questions and I was answering from the comfort of my home. So I recorded some of these questions and I'm going to be answering them based on, say, I get one sister will be healthcare assistant. We don't date here for 30, and she told me the correct answers to these questions. So I'm going to be giving you the answer so that in case you're already in the UK and you're applying for a role of a healthcare assistant, perhaps you are still back in your home country like in Nigeria and you plan to come and take up the role of a healthcare assistant, then this video is on spot, like is a perfect video for you to see. So there were about 15 questions. I was asked 15 questions, but just like 4 of those questions were based on identification. Now, biodata, asking me if I have any nursing experience, asking me if I have right to work in the UK, and blah, 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 blah. So in no particular order, I'm going to be sharing the 11 questions that were technical questions, and I'm going to be answering them for you. So the first question is, what do you look for when assessing risk? When you first enter a new client's home, what safety measures do you observe to keep you and the patient safe while you are working? So the first thing that you have to do when you are assigned to a new client, especially when we are talking about domiciliary care. Okay, domiciliary care is the kind of services that you render in the client's home, like you go to your client's home to take care of them. While care homes are like flats that have different rooms, like all those suites in the hospital here for VIPs. If you're planning to work as a carer, I think you should have a background knowledge of all these things. So the first thing you need to do is to ask for the patient's history. There's something called care plan. So you should have a look at the care plan of the patient you're going to be taking care of so that you'll be familiar with what is the medical history of this patient. What should I look out for? Is this patient one that has some mental issues? Hey, is this patient prone to fall? What past history does this patient have? So that you are not new to the patient, you're not new to some of the behaviors that the patient might start exhibiting on your arrival, so that you can also know how to, keep yourself safe. Perhaps the patient is the aggressive type and all that. So the first risk assessment that you have to take is to go through the patient care plan to have a background knowledge of the medical history of that patient. So that being said, the next question says that how do you manage mental health issues or issues? So if you have experience dealing with patients in mental illness, please discuss what you have done to assist them. Alternatively, if you have training in that area, please discuss the level of training that you have. So personally, I don't have any training in mental health. So my answer was straight no. I have no experience, so I couldn't have answered the first part of the question. But if you have experience in mental health, you can please help us answer this question in the comment section. So quickly to the third question. How do you prevent infection? How do you go about preventing infection in a client's home? So when you get to a client's home, some of the roles that you're expected to perform as a care assistant includes cooking for that patient, feeding the patient. And in the process of cooking or feeding, you could introduce infections into the food, or you could even, get infections from the patient's house and take it to your own house. So you really have to put in some safety measures, including putting on your PPEs. Your PPEs include your hand gloves. You wear your hand gloves. You wear your aprons. You wear your uniform. You wear your face mask when necessary. And then when you're preparing the meal, before you prepare the meal, you make sure that you wash your hands. After preparing the meals, you wash your hands. You wash your hands very frequently when you are in clients' home, even in your own home. You need to, make hand washing a habit as a carer. And then when you're preparing your client's meal, if you have fruits and veggies, you really have to wash them under running water to get rid of any dirt and all that. And then any food that needs warming, you have to warm that food to the appropriate temperature. Then when you are storing food, you store them appropriately. You store like raw food at the bottom of the refrigerator or the freezer. You don't go stocking raw food like beef and all that at the top of the freezer, and then it starts leaking and staining the other part of the refrigerator. The next question is, how do you assist showering safely? Please describe how you would help a patient in and out of the shower and identify any precautions in which you would take. So first thing to note when you are asked questions about showering is that you have to carry out risk assessments. Like, you have to understand what your client is at the risk of, like whether your client is at the risk of a fall, or your client is one that is having incontinence and all of those. And after that, you have to ensure that you have two people, you have a partner. One person cannot carry out a bath, a wash. So you have to uh, call an assistant, somebody else to join you. If nobody has been assigned to you, that is one. Then you have to prepare everything that your client is going to need in the bathroom, because you are obviously having a shower. You're not just doing a bed wash. So you carry everything, including the cloth of change, or is this the change clothes that the patient is going to change to, the sponge, the cream. It won't speak well of you after you're already in the bathroom bathing your patient, and then you remember that the cream is inside the room. It won't make any sense. So you carry everything you need, including the towel, everything. You carry it inside the bathroom, and then you involve your client. You seek the consent. You tell your client, hello Rosemary, so now you're about to have a shower. So for your patients to be going inside the bathroom to bath, it means there's some level of mobility. So depending on the type of patients, you assist your patient from the bed to the bathroom. And then when you get there, you make the patient sit on the commode, on the commode chair. There's a shower chair here, so you transfer from the wheelchair to the shower chair. And another thing you should notice is that your patient must be involved in their self-care. How do I mean? Maybe after washing the patient's face, you could ask the patient to wash his or her neck. Just make sure the person is involved one way or the other. Ask for the consent. Could you wash your neck? Can you wash your neck? If the person consents, you allow, and all that. And always communicate while you are doing all of these things. So another thing is that you should ensure the privacy of your patients. They are entitled to their privacy. They're entitled to their dignity. Like, you have to make sure that everywhere is enclosed in the bathroom. The windows, ensure that nobody is peeping through, nobody can peep through. The doors, ensure the door is closed. As you're washing, as you're bathing, you have to take note whether there's a pressure sore or there are pressure sores, because they sleep on a particular part of their body frequently or most times, so they develop this red sore. So if you find any pressure sore, there's a cream that you apply on it. And after doing that, make sure that you put a dry towel on the floor, so that when the patient is getting outside the bathroom, he's not stepping on water and there's no kind of fall. So you try as much as possible to prevent any kind of fall after bathing. Then you ensure that your patient, if he wants to defecate, you ensure that you ask and you clean up the mess before you transfer the patient back into the room, onto the bed. So I think that's that about that. Some of the precautions are you maintain the patient's privacy and dignity, you involve the patient in the self-care, and also you check for pressure sores and all of that. So the next question is, how do you undo falls? You are walking across the room and your patient begins to fall. what do you do to prevent that fall from happening? If you cannot prevent that fall from happening and then they do fall on the floor, what do you do next? So it all depends on the kind of setting. We have the home care, or you call care home, and we have the domiciliary care. So domiciliary care, for instance, now you are the only carer with this patient in the house, and your patient is about to fall. Now, whether domiciliary or care home, you don't prevent a fall. You are not in the position to prevent a patient from falling. It's not like back home when an elderly person wants to, topple over, you try to rescue. You don't do that here, because in the process of trying to rescue that person, you can also injure yourself. So if they want to fall, just leave them, let them fall. Now, after a fall has occurred, but as a carer, the first thing is to try as much as possible to prevent anything that can make your patient fall. But if the fall eventually occurs, what you need to do as a carer in the domiciliary setting, in the patient's home, is to call the emergency number. I think that's 999. I think so. Please let me confirm in the comment section. You call the emergency number, and the emergency will tell you, and then take note of the time that the fall occurs, because everything that you have to do, you have to record in the care plan. When you are bathing, you record everything you see. If you see any mark, record in the care plan. So you have to record when the patient falls in the care plan. So take note of the time, take note of when you called the emergency number, take note of whatever action they ask you to take. Maybe they will ask you to carry out a CPR, or to stop bleeding and all of that, in case there's any form of bleeding. And also, this is for education purposes. Don't forget, when you're done calling 911, is it 999, the next person you should call is your organization, your office. As a domiciliary carer, you call your office and you inform them about what has happened. And then while the ambulance is coming for the patient, the office is also aware, and you would be safe by so doing. But where you are in the care home, you don't really have to call 911. Just press the alarm and call the attention of other people, your superiors, and that will be sorted. So I think that's about that particular question. So the next question is, how do you help patients to stand up? How would you help a relatively mobile client to stand from a chair, move into their Zimmer frame, and walk across a room? Describe the steps in which you would take. First thing is, you have to seek consent. Always remember this one. You have to involve these clients in the care of these clients. They have to be involved. You have to maintain their dignity. You have to, make them feel like they are also independent. So you seek the client. Say, hi, Alex. Now I'm about to move you from the chair to your Zimmer frame, and then you walk to wherever you're walking to. So always remember this also, that you don't hold them by the what? By the armpit, or by the you don't hold them by the armpit, because these people are mostly elderly people that are weak and frail. So in holding them by the armpits, God forbid bad thing, anything can happen. So what you do is, it's not as if this person is completely immobile. Remember, they said relatively mobile. So you just say, okay, Alex, now I'm about to move you. Can you please move forward? So the person is going to move forward from the chair to the tip of the chair. And the next thing is for you to support the person by the waist. Support the person by the waist. Okay, at the count of 3, you stand up. 1, 2, 3. Then the person stands up. Not be saying that you pull the person up. The person stand up by himself. But you supported the person by placing your hand behind the person's back. And when the person stands up, before he stands up, ensure that the Zimmer frame, that's the walking stick. There are different types of walking aids. One of them is walking stick, one of them is Zimmer frame. I'm going to be leaving the picture on the screen for you. 1, 2, 3, the hands are already on the frame. The person stands, and you can even place your legs on the Zimmer frames also, just for additional support you get. So the person will stand up, and then you can move the chair away, and then you walk with the patient side by side. You don't go ahead in front, or you stay at the back. Walk side by side, ensuring that there are no obstacles that could cause a fall, or obstruct movements. And I think that about that question. The next one is how do you get patients to take meds? That's medications. Sometimes a client might refuse to take their medication. What would you do in this situation? Always remember, my dear friends, that these patients have rights to make their choices. So you can only encourage, you can encourage them to take their meds. If the person is not complying, you could, ask whether you can come back in a moment. You could highlight some of the benefits, like if you take this meds, you feel a lot better. If you take this meds, it will help you stay stronger and all that. But if the person insists that he or she is not taking the meds, you can't force. So you just leave them and you record it in the care plan that your patient has refused his or her medication. So that answers that particular question. The next question says that how do you manage dementia? When patients suffer from dementia, which can be challenging to manage, can you describe a difficult patient you have had and explain to me how you get them to comply with taking medications or washing? Additionally, what steps would you take if a patient refuses to take their medication? Um, so dementia is a condition of memory loss. Like the patient does not remember anything, and in most cases they are agitated, and they can be aggressive because they are trying to remember something, they are not remembering it, and they might not want to see. They might tell you, "Go away! I don't want to take my med." Some of them, they will collect that med and discard it. They won't use it. Some of them will tell you, "Yes, the meds are in the bin." So in that case, your safety first, because mostly they might be aggressive. So you put your own safety first, risk assessment first. Is it safe for you to even try to encourage this person? If it is not safe, and if the person is saying no, he or she is not using, you cannot force them. Just let them be. I don't know a scenario yet, but that is how I answered the question. So if you have better answers to this question, you can help us put it in the comment section. How do you manage the family? When working as a private carer, building a solid relationship with the family is essential. Can you describe a challenging situation you have experienced with a family or family member and how you resolved it? Alternatively, explain how you have used feedback from a family member to improve your care, either directly or through central office. So these are two questions and you have to answer either of them, but I'll give you scenarios of the two. So the first one is saying that, have you had any difficult situation with any family member? Okay, I heard of a situation where a particular patient, or you call them client, offered a carer a an expensive bag, and the carer, knowing the policies of the organization, declined the offer. But this client insisted that the carer should have the bag, and knowing that the mental state of the person has dementia now. So this carer informed her manager, and the manager, after so much persuasion, the manager asked her to collect it from the client and put it on her table. So she collected the bag and dropped it on her table. But later, the family member of this client came to report the carer to the manager that she stole their patient's bag. She stole their family member's bag. And that was when the manager came in and said, the bag is actually in my office, this happened. And that was how it was resolved. Thank God the carer had not collected the bag and she had not taken it home. If that had happened, that probably would have been the end of her career. So alternatively, I've heard of instances where um, you know, a family member or even the client gave a commendation, a good commendation to the organization about the carer, and the organization actually gave the carer an award. Yeah, because the carer had commended her and all of that. So that's another thing. And then the carer felt really, really fulfilled, and she wanted to just do more in this career. So that's another example. So the next question is, how do you help a seemingly immobile patient to get out of bed into the wheelchair using a sling, hoist, or something, something? So I'm going to leave the picture of a sling and hoist on the screen for you to see. a sling is just like a carriage, like a baby carriage, baby carrier that we use to carry babies at the front here as women. A sling is something similar to that. So it has belts that you can snap together, and then hoist is the one that actually is like a lift that you couple the sling to, and it lifts the patient up. So you can watch YouTube videos on how to use the sling and the hoist. So the first thing you have to note is that you need to carry this patient along. See, patient consent is very essential here. Unlike maybe back home where the health practitioner, has some level of superiority and some level of power over the patient. Here, the care is patient-centered, so you really have to involve the patient. So the first thing you have to note is that you seek the consent of the patient, even if the patient don't die. You have to still seek the patients because they have rights to make choices. So even if na cops they talk to you, you say, hello Adam, now I'm going to clean you up, even though the person don't die. Not to talk of person where they are alive. Somebody that is alive, you really have to seek their consent too. You summarize what you're about to do. Okay, I want to get you from this bed to the wheelchair. First thing is to get the wheelchair and everything you're going to be needing, the sling, the hoist, get them close. And also this procedure has to be taken by 2 people, minimum of 2 people. So one person cannot do this. If you try to do it alone, it could lead to something more serious, and it could cost you your career and everything you have worked for. So the first thing you need to do is gather everything that you need close. Then you carry out risk assessment too. What this particular patient is suffering from, and some of the things this person is at the risk of. So the next thing is for you to lift the patient's knee. You lift the knee, then you roll the patient to one side. You slide in the sling, and then the person on the other hand, you keep communicating with each other, and then you keep communicating with the patient. Then the person on the other side does the same thing, and then turns the patient the other way to extend the sling. I wish I could demonstrate all this, but no, I can't. So after that is done, you couple all the belts together, the ones by the thigh, the ones by the waist, you couple them together, and then you couple everything on the hoist. So there are 2 types of hoist. We have the manual and we have the ceiling. For an immobile patient, oftentimes it's the ceiling hoist that we use, but for patients, some of them use manual hoist. So you bring the hoist close, couple the sling to the hoist, and then you operate it. It lifts the patient up and ensure that the patient's leg is not touching the bed. So when it lifts the patient up, you move it gently and slowly. Then you move it. Ensure that the wheelchair is locked. The wheels are locked, so that it's not as if the wheel starts moving when you put the patient on the chair. So you lower the patient on the chair, allow the patient to sit, then you uncouple all of those things, and that would be the end of the procedure. So I think this is the end of the entire interview, and I hope this has helped you. If you have any other thing to add to everything I've said, please feel free to do so in the comment section. And if you see my face for the very first time, don't go away without smashing your subscribe button and turn on notifications. Thank you, and I hope to see you in my subsequent videos.